Malnutrition, or can be called as severe acute malnutrition. Best indicator of malnutrition for acute is decrease in weight for height, and in chronic malnutrition is decrease in height for age, that is stunting. So malnutrition disorders further divided into two: kwashiorkor and marasmus. In kwashiorkor there is presence of edema, and in marasmus there is absence of edema. Kwashiorkor is for the deficiency of protein and marasmus is for the deficiency of carbohydrates. In kwashiorkor, appetite is poor, and in marasmus, appetite is voracious. CNS manifestations in the kwashiorkors are apathy and lethargy, and in marasmus, patient is active and alert. Hepatomegaly in kwashiorkor is seen, and it is not seen in marasmus. Skin and hair changes more common in kwashiorkor. Skin become flaky, pant dermatosis, and hair appear as flag sign. And in marasmus, there are no such signs regarding skin and hair changes. Now, what is severe acute malnutrition? It is defined as when a child of 6 months to 5 years of age presence of one or more of the following criteria is there. These criteria are when the weight for height is less than 3 z-score or less than 70% of expected, that is severe wasting. Mild is mid upper arm circumference is less than 11.5 centimeter. Symmetrical bipedal edema of nutrition origin. So, complication of severe acute malnourishment are sugar deficiency, that is hypoglycemia, blood sugar will be less than 54 gram mg per dl, and in hypothermia, rectal temperature will be less than 35.5 degrees Celsius. Infections are there, electrolyte imbalance is there like hypokalemia or hypophosphatemia. Dehydration will be there and deficiency of micronutrients. So, moving on to the management part. First, patient is hospitalized. Treatment of complications like sugar deficiency, we give the 10% dextrose, and for hypothermia, we will warm up the patient. For infections, antibiotics are given. Electrolyte imbalance, supplement potassium and phosphate are given. For dehydration, WHO ORS or rehydral solution is given, and in deficiency of micronutrients, supplementation is given. And so next is nutritional rehabilitation. Should be gradual to prevent nutritional recovery syndrome or refeeding syndrome. Start with low calories and protein and gradually build up. What are the fluids what are given in the malnourishment? These are, initially we will give the F75, that means it provides 75 kilocalories per 100 ml of fluid. Then is F100, that means fructose 100, which provide 100 kilocalories per 100 ml of the fluid. Later RUFT, RUTF, which provide 543 kilocalories per 100 gram of the fluid. Ready to use therapeutic food, it is. Fluid and electrolytes given are according to total body water. 60% of body weight by 2 years of age and remain so till puberty. Fluid of the choice earlier is half DNS added with the potassium, and in neonates when the birth weight is when to give fluids in the neonate when the birth weight is less than 1.5 kg or by the day 7th of life if the dehydration is seen, like which is replenished by the D10 fluid, and fluid of choice for shock in children is normal saline.